I am Dr. Lewis with and Nutrition. Today we're going to talk about an interesting topic. It's called plantar fasciitis. I'm going to put myself in this category because I have experienced this myself. We can get out there and do your walking, running, jogging. Some of you may have plans to get involved in some long distance marathon events, and you want to get your feet right for those particular types of activities. What is plantar fasciitis? Plantar fasciitis is inflammation of the plantar fascia. The plantar fascia is a very thick ligament that occurs at the bottom of the feet. It attaches from the heel to the toes. Its function is to work as a shock absorption of the feet, where we're running, jumping, going from one end of the room to the other. It helps support our arches. It also aids in tension when there's a lot of tension due to the weight that we put on our feet. All right. So that's the function of the plantar fascia. What are the symptoms of plantar fasciitis? Sharp pain that occurs at the bottom of the heel. Sometimes it can occur around the arches. Now let's get with the causes. Now, when I get through these causes, now don't jump to conclusions and start throwing away your shoes or your heels, okay? I'm going to give you all a alternative for that. I'm going to show you how we can make some adjustments to that along the way. So these are the causes of plantar fasciitis. Number one are high heels, okay? Now, I know some of you may work at a job that have very strict dress codes. You have to wear heels. You have to do a lot of standing or walking. But don't worry, we're going to make some adjustments to that, okay? You find yourself wearing heels and you go home and just in the middle of the night or when you get out of bed in the morning, you will feel some discomfort or pain at the bottom of your feet. That's because when you wear heels for a long period of time, let's say my hand is my foot. The heels will definitely bring your heel up, of course, you know that. But that will stretch the plantar fascia. When that plantar fascia is stretched for a long period of time, that's going to create little micro tears along that plantar fascia. And that's when that structure is going to become inflamed or flare up, and you begin to experience some pain there. Another type of shoe that can cause this problem are flats, because flats and also flip-flops does not have any arch supports. We need arch supports, especially if you are flat-footed, okay? So if you're wearing flats for long periods of time or flip-flops and they don't have any arch supports, eventually that's gonna put a whole lot of stress on the plantar fascia. Another cause is that our shoes that are poorly designed. Now, if you're like me, you like to shop online for shoes, and sometimes we can get fascinated with the look of the shoe. We know that looks can be deceiving. We can get fascinated with the look of the shoe. We like the colors. It appears to look comfortable. But once we put our feet in those shoes, we go for a long walk or jog, we begin to experience pain at the bottom of our feet. Why? Because they're poorly designed. They don't have the padding on the inside, does not have enough arch support, okay? And also when our shoes, when we purchase shoes that are poorly designed, you can actually feel the pressure in those shoes shifting. Let's say these are my feet again, shifting our feet going this way. This is called pronation. You got pronation, supination. Pronation was when the feet go inward due to a lack of arch support, and that's going to put more stress on that plantar fascia. Another cause are old shoes, okay? Studies have said that we're supposed to keep our running shoes for about 6 or 7 months, all right? After a while, it's time to switch it out. Now, I'm gonna use an old mattress as an analogy. If you keep a mattress for a longer period of time, for 8 or 9 years or 10 years, eventually you're gonna feel some, excuse me, some soreness on your neck and back. That means it's time to get a new one. Same thing with old shoes. Eventually, the padding on the inside is going to wear down. The arch on that padding that support our arches is going to wear down. And eventually, that's going to put a lot of stress or strain on the arches. Okay. Another thing is foot structure. All right. Once again, you want to look at the structure of your feet. All right. If you stand in the mirror and that both of your feet are shifting in, once again, it's called pronation. That means that you are flat-footed. Your feet has no arches. Okay. So you have to get some shoes that have good arch supports. And like I said, I'm going to show you all how to make some adjustments to that. All right. Another one is being overweight. All right. Once again, the function of the plantar fascia is to help with support or load the weight on our feet. Anyone who is obese, overweight, will eventually have this problem. All right. How to fix that? Lose weight. All right. When we lose the weight, that will take the load off of our feet. Okay. Another thing is overuse and the type of walking surfaces. Like I said, I know that some of us are required to be on our feet a lot on the job. And maybe working or standing on hard surfaces, walking on hard surfaces. How to fix that? Okay. We have to use shoe inserts. Okay. And I'm going to show you all what that is in a minute. All right. Simple treatments, physical therapy. All right. Physical therapy will help strengthen the arches. Okay. Another thing that y'all can purchase, you can find this online, is called a dorsal night splint. All right. It looks like a boot. Okay. You wear that at night while you're sleeping. And what that does is that it brings our feet or our foot up at a 90-degree angle. When our foot is up at a 90-degree angle, that's going to help take some relief off the plantar fascia. All right. Going back to the shoe inserts. Now, here's the biggest mistake people make with shoe inserts. I know that when we go to our local Walgreens store, Walmart, CVS, we see the shoe inserts. But here's the biggest mistake. People purchase shoe inserts that are not designed or is not specifically made for their symptoms, okay? There is a way where you can get shoe inserts custom made for your condition. If you have plantar fasciitis, there's a way you can go online or Amazon and you can put in your shoe size, the symptoms that you're having. If you have plantar fasciitis on the arches, if you have high arches, or you don't have no arches at all, they can make those shoe inserts for that, okay? You can get them made for your heels. So once again, you don't have to throw away your heels. You can also get them made for your tennis shoes, okay? It's also going to ask you about your activity level. If you do moderate athletic activities or intense athletic activities, if your job requires for you to stand a lot, walk a lot, you can get those inserts specifically made for that. And that will help relieve the plantar fasciitis that you're having. One of my favorite solutions is for that problem, chiropractic care, all right? How do we fix that in the chiropractic arena? The first thing we do is we clear the spine, especially the lower back. When we adjust the lower back, especially the lumbar region, that will create signals going from the lower back down to the feet to help relieve the pain. But we don't stop there. We go to the feet and we start doing some work on the joints that surrounds the arches or the plantar fascia. We use this device called a cold laser ultrasound or shockwave therapy. The purpose for that is to produce a laser that penetrates deep into the skin on the arch of the foot to help break up the scar tissue that's causing the pain, the inflammation or swelling. It's going to reduce that, okay? It's also going to help reduce some of the fibrotic tissue that's causing the discomfort. So that's one of my favorite solutions to the problem. Okay. Now let's talk about some shoes that we can wear to help relieve this issue here. All right. Once again, I made several mistakes purchasing running shoes. I figured in my mind they're just running shoes. I'm just going to go run in them. I don't need anything expensive or anything that can address my condition. But guess what? After I got finished running, I personally had plantar fasciitis. Okay. So one of the best shoes that are out there that's on top of the line, these are called Hoka's. Okay. And these are the best overall. It will help address the plantar fasciitis. Also, you have no arches on your feet. These are some good shoes to wear here. If you have Achilles tendonitis, these are also good, okay? There are some insurance companies that will definitely issue these shoes out if you go see your podiatrist. So you may want to look into that. Another shoe are called, we also have the Brooks Ghost. Okay, I personally wear these when I go running. Okay, I'm telling you, I thought that my running days were over. Come to find out, the issue was the shoe. Okay, so when I purchased a pair of those Brooks Ghosts, it really helped relieve my issue with plantar fasciitis. It helped relieve the pain that I was experiencing on the bottom of my heel and arch. Those are some good shoes. Okay. They also have here, I have Asics women's gel for overpronation. Once again, if you see that your feet are going in this way, the Asics women's gel have good arch supports to get our feet back to its level, okay? Help support the arches, all right? We have the New Balance Fresh Foam for high arches, if your arches are too high. Mizuno Wave Inspire 19 for heel pain. Once again, if you have plantar fasciitis and you have pain on your heels, those are good to wear. Okay. All right. So you don't want to throw away if you like wearing flats or flip flops, and you don't want to stop wearing those because you like the design, you like the fashion. You can also look into a different alternative called Clark's Cloud Steppers. They come in sandals, regular shoes for men and women, and also come in flip-flops, okay? Those have excellent arch supports if you have that problem. I know someone who had plantar fasciitis, and she didn't see a chiropractor. She didn't see a doctor about it. But when she started wearing the Clark's Cloud Steppers, that helped relieve her pain, okay? So there are some invasive treatments for that. They do steroid injections, but you don't want to experience those side effects. If your condition is severe, then consult with your podiatrist about getting that done. But if your condition is on and off, the only time you feel it is if you're going running or walking or for a light jog, try these alternatives and it will definitely give you the difference. Okay? I'm Dr. Lewis. Please like, subscribe, and share our YouTube channel. And remember, your health is your greatest investment.